I'd like to turn to a second issue. Really, it's the idea of the team that's going to potentially, the healthcare team that's going to be involved in the care of a woman who's diagnosed with ovarian cancer. So, Dr. Chura, who's typically involved in the care of a patient with ovarian cancer?
So the bias I have is that the care can be directed by a gynecologic oncologist, a specialist that can take care of the disease from the operating room to the chemotherapy infusions to the survivorship afterwards, to sort of provide a continuum of care for that patient, so that GYN oncologists spend, several additional years studying, treating ovarian cancer, and that really becomes a core of our expertise. So having a GYN oncologist as part of the treatment team, from my perspective, is critical for patients to have comprehensive care, to have longitudinal care, so that they're not passed off from provider to provider along the way.
So Justin, a woman now has ovarian cancer, or highly suspected of ovarian cancer, or might even have now had that diagnosis of ovarian cancer. She comes in, has that first conversation, usually with her family. What do you talk about at that point in time? It's new diagnosis of ovarian cancer.
So we first talk about what is the apparent stage of the disease, whether that's based upon CAT scan or prior biopsy findings, and acknowledging that that's not a variable we can change, but it is important in terms of prognosis for the person in front of us. We also then talk about what will our treatment plan be and how will we sequence the treatments. The cornerstones, as you know, are surgery and chemotherapy, and sometimes it'll be surgery followed by chemotherapy. Sometimes it can be chemotherapy with surgery in the middle, followed by additional chemotherapy. And then it's also looking at the overall condition of the patient and what we think can be tolerated by the body in terms of the stress of surgery, the stress of treatment. And really, as a physician, there's only a couple points of influence that I can really impact. I can't impact whether a patient is going to have cancer that responds to chemotherapy or not. I can't impact their stage when they walk through the door, but one of the biggest impacts I can have is with the surgical intervention, meaning can we achieve a complete resection of all the cancer that's there? That's the one role where a surgeon, a GYN oncologist, can play a big role in a patient's overall prognosis, because we know that patients who have complete resection of their disease tend to do better in terms of overall survival compared to those who don't.
So with all the information that you're attempting to deliver in a very difficult situation, are there a few key points that you want to hope that the patient, and again, and her family or advisors who are going to help remember all this stuff later, you want to convey at that point in time?
I think one is that despite, being advanced stage, people shouldn't go home to prepare to die, as Anya did. Most women, we can achieve a remission. With a combination of surgery and chemotherapy, we can get to a point where a patient will be in remission for a time. And then really, as I explained to patients, there's sort of several milestones that we walk past in terms of prognosis. So the first we said is stage. We can't influence that. The second is the success of the surgery in terms of removing the tumor that's there. Can we resect every area of cancer? The next is, what is the response to chemotherapy? Is the patient platinum sensitive, which we'll touch upon more later, but do we achieve a remission? Then, achieving that remission, what really will drive prognosis is how long does that remission last? Whether it's 1 month, 1 year, 3 years, really changes how we then approach the patient when there's recurrence. So those are some of the key milestones that we have to walk down, and obviously we don't know for the individual until we start down that path. But despite advanced stage, despite what sounds like a horrible diagnosis, most women will have a response to treatment.
So one more question, and then I'm going to turn to Anya. You very clearly and very eloquently described very important issues that need to be discussed with the patient and her family. You and I obviously have a lot of experience doing that, and we do it often, and we sort of know what we want to say, how we want to say it. On the other hand, the patient and her family, this is their first time. And for initial diagnosis, it's only going to happen once. So patients come and families come at different points in their lives, different backgrounds, et cetera. How do you deal with, it's obviously a general question, but a very complex one. How do you deal with the patient and the family? You know what you want to convey, but again, they're at different points, different places in their lives, et cetera. How do you deal with that variability?
Sure. Part of that is assessing what is the patient's understanding of her disease and also the family members present there as well. Because a lot of people will have come in trying to have done some basic research to have a sense of what the treatments may be. And although there are a lot of resources, there are only a few reliable and credible ones that I would point patients towards. And so it's assessing where is the patient in her understanding of what we can achieve, what is realistic, what is not, and then trying to really individualize the discussion and then eventually the treatment plan to meet the patient with her goals of treatment, her goals of care.
So Anya, now turning to you, how? Obviously you have a wonderful doctor, and you've been through this journey now for a number of years. How important is that healthcare team, the doctor and the individuals working with that team? How important was it to you, is it to you, and for other patients, in your opinion?
I would say the initial conversation right after the diagnosis is of a prime importance because it's up to the doctor to instill hope. My first doctor, who was also happened to be a wonderful doctor, told me, statistics are only good as for the research. Don't look at the statistics. Because I cited him that almost...
You are not a statistic.
You're not a statistic. Actually, you have a 50-50 chance. And he was right. Dr. Chura also says about the same thing. He says, if I could clone you, I could try different modalities, different drugs, but I can't. So every person responds differently, physically, emotionally, mentally. The main objective, aside from the treatment from the doctor, is to instill hope. It's achievable. I know people who survive this disease. I know people who live long, and we all should have this hope.